Community Health Assessment, Catawba County, North Carolina. Opioid addiction in homeless and socioeconomically disadvantaged populations. The Community Health Assessment presented by Nancy Dodenhoff, Ariana Jackson, and Tina Morissette for Population and Community Health. Introduction. Catawba County, North Carolina is located in the foothills of the Blue Ridge Mountains in the western part of the state. The population is 156,459, with 51% female and 49% male. The majority of the population is white at 76%, with 10% Hispanic and 9% African American, 4% Asian, and 1% other. The average housing cost is $139,900, and the average rent is $700. While the ethnic makeup of Catawba County is largely white, there is an ethnic disparity in the poverty rates. The ethnic makeup by poverty level is 54% white, 18% Hispanic, 13% Black, 4% Asian, and 11% other. In a side-by-side comparison, Catawba County's median household income is lower than the average of North Carolina and the United States, and those living below poverty level using food stamps or uninsured are significantly higher than both North Carolina and the United States. The opioid death rates continue to climb in North Carolina. The opioid crisis continues to be a growing concern, and there is a link between socioeconomic depression, homelessness, and substance abuse. The racial disparity creates greater concern of the potential for health inequity. Hickory, North Carolina, located in Catawba County, is listed as the 5th highest rate of opioid abuse in the United States. The rural South has disproportionate numbers of cities on that list. In 2017, there were 122 documented opioid overdoses. Substance abuse accounted for 3.79% of all emergency department visits, and 13% of those were opioid related. Catawba County has 2 major hospitals, 24.4 physicians per 10,000 residents, 4.4 dentists per 10,000 residents, and 1 public health department. The link between homelessness and substance abuse is shown as it helps to cope with challenges of financial and domicile insecurity, minimizes concerns over the physical effects of living conditions such as injury, disease, and nutritional deficiencies. It's made worse by a lack of social support, and it can mask pain caused by trauma from violence and abuse. The rationale for the community health selection is based on statistics derived from Catawba County State of the County Health Report and the United States Census. Opioid abuse continues to be a significant problem. With the disproportionate rate of substance abuse and ethnicities in lower socioeconomic and homeless populations, we elected to focus on this problem within the group. Community assessment includes the windshield survey, informant interview, secondary analysis, and synthesis of assessment data. The windshield survey: housing conditions, health resources, road conditions, transportations, food and drug resources. The housing conditions include luxury homes set near country clubs and Lake Hickory, apartment homes, rural farms, government housing, income-restricted apartments, Habitat for Humanity builds, and tent cities. As you drive through Hickory, Conover, and Newton, North Carolina, in Catawba County, you notice the high-end homes near country clubs and Lake Hickory. In the downtown area, there are individuals with backpacks waiting in lines near soup kitchens, the Salvation Army, near the railroad tracks, and at the off-ramps of the interstate. Catawba County has 2 acute care hospitals, Frye Regional Medical Center and Catawba Valley Medical Center. Frye's South Campus is an 81-bed acute inpatient behavioral health hospital, and there are multiple urgent care and minute clinics. Additional health resources include physician practices, pain centers, skilled nursing facilities, and home health. Health resources for vulnerable persons include soup kitchens, shelters, drug rehabilitation centers, food pantries, and support for recovering drug addicts. The road conditions in the city include paved sidewalks. In the rural areas, they have mostly paved roads with some dirt or gravel roads. Transportation is limited bus service in the city limits, as well as taxi and Uber services, and the rural areas have minimal transportation options. There is a large selection of both grocery stores and pharmacies, including Publix, Food Lion, Walmart, Lowe's, Walgreens, CVS, Medicap, and HealthSmart. The informant interview with our key stakeholder, Sarah Rhodes, the clinical nurse supervisor at Catawba County Public Health Department, tells us that the demographics in the health department are primarily white with equal numbers of Hispanic and African Americans, primarily female with an age range of 14 to 80. They do not have methadone treatment at the health center. Substance abuse is often identified during the secondary survey, but the crisis resources include behavioral health crisis intervention, methadone clinics, needle exchange program, and shelters and soup kitchens. The educational needs include that they have instructed the providers in relation to opioid prescribing, and patient needs include tobacco cessation, better nutrition, and physical activity. Of note, community health assessment is released every 4 years, with the last report being 2015. Opioid abuse is likely to be a rising concern in the new report, per Sarah Rhodes. The synthesis of assessment data. In 2017, there were 1,652 live births, 11 neonatal deaths, 15 infant deaths, and no recorded maternal deaths. The functional ability level offers a full range of services available for all areas of concern and all levels of need. It includes Medicaid transportation, senior and adult services, family support, and family and children services. The structure of the health facilities are adequate resources. Catawba Valley Medical Center has 258 beds, and Frye Regional Medical Center has 355 beds. Health disparities exist among African American and Latino communities, and there is a large resource of voluntary health associations and resources for uninsured or others in need of assistance. Processes for improvement include yearly state of the county health reports updating community health issues, action teams with an eye towards inclusiveness and diversity, community health summit to allow for community input, and Catawba County Health Partners, a nonprofit organization who work to develop strategies and interventions. Community diagnosis, opioid addiction in lower socioeconomic groups. Strengths, weaknesses, top health issue. The strengths are supporting the syringe exchange program, which is available at the local health department, known as the FARM, which stands for Foothills Area Harm Reduction Mission. This is a nonprofit organization that goes out to the homes of individuals to provide clean needles and help people to pursue rehabilitation programs. There's adherence to the North Carolina Opioid Action Plan, a bill which makes naloxone or Narcan available to police officers to avoid opioid-associated deaths. This bill also helps to expand treatment and recovery systems and increase community awareness and prevention. Strengths are help for managing substance abuse, disorder treatment options available for those who are eligible for Medicaid. LEAD, which stands for Law Enforcement Assisted Diversion, helps low-level offenders related to substance abuse have access to community-based programs instead of jail. And overdose response teams who reach out to clients with recent overdose and assist them with treatment options for addiction through treatment centers or medication-assisted therapy at a primary care provider. The weaknesses are a lack of access to health care and the cost of health care, lack of education regarding accessibility to treatment programs or addiction support groups, and Catawba County's current unemployment rate, which is about 4%. Unemployment is linked to higher opioid prescription rates. Top health issue is opioid addiction in lower socioeconomic groups. Primary interventions include teaching providers, since persons who are low income or on Medicaid are at higher risk for prescription drug overdose. Safe opioid prescribing education and implementation should take place. The providers should also be educated on the importance of referrals to pain specialists. Patients on chronic pain medication can also be educated regarding proper disposal and storage. Secondary interventions include a bill that was passed by the state of North Carolina called the Heroin and Opioid Prevention and Enforcement Act, or HOPE, that gives appropriate access to prescription medications, helping to reduce Medicaid and prescription fraud, as well as doctor shopping. And tertiary interventions include educating citizens that there are 7 addiction centers in Catawba County that can help fight this problem. And do not give up hope. In conclusion, Catawba County has a high incidence of opioid addiction and homelessness. There is racial disparity in the lower socioeconomic group with a higher percentage of Hispanic and African Americans, inconsistent with the population demographics. There is a documented link between financial or domicile insecurity and substance abuse. Although Catawba County has adequate services available, the need for assistance and education is still great. Influencing our future practice. While all learning experiences provide opportunities for growth, this one has reinforced the importance of being vigilant to disparity in healthcare. Fully assess all patients, but particularly those at greatest risk for substance abuse, homelessness, and access to healthcare. Try to remain attentive and current to the resources available in the communities we serve and make referrals as needed. References.